Hi guys, welcome back to another episode of Hola Meds. I'm your host Kimberly, and today we're going to be tackling a question that I'm sure you said at some point or the other. Even if you didn't say it out loud, I'm sure you thought it. We're going to be talking about patient wait time. So at some point in time, I'm sure you've been to the pharmacy and you thought to yourself, what's the hold up with my meds? You know, what is taking so long? So today we are joined by head pharmacist at Fontana Pharmacy Waterloo, Jerry Tomlin. Hi Jerry, thank you so much for joining us. It's a pleasure having you on set.
Thank you, Kim. It's good to be here.
How are you?
I'm great, thanks. How are you?
I'm better now that you're here. It's great to see you. This, I think, is a burning question for a lot of patients. At some point or the other, they've complained about, you know, why am I waiting so long? I can see the drug back there. I can see that you have them. Why do I have to wait so long for my prescription? So today we really want to give the viewers a better idea of all of the factors that go into processing a prescription and some of the things that would contribute to the wait time at the pharmacy. So right off the bat, that's what I want to ask you. What goes into filling a prescription?
Well, Kim, as you know, for the pharmacy profession on a whole, it's very dynamic. And right now we're talking about a community or retail pharmacy, which is probably going to be the person that you see the most on your healthcare journey. Off the bat, when you bring a prescription in, we are going to take a glance at it. What we're doing is we're trying to evaluate it to ensure that one, it's a legal prescription, two, it meets all the requirements that we need to process it, as well as we may be looking to evaluate the medication that is there and ensure that one, we have it in stock, the correct dose is there, the frequency is there, and the duration is there. And this is all at maybe a 2 or 3 second glance. From there, we would process your prescription. We'll go ahead and make another evaluation to ensure that there are no drug interactions on the
So I just have to break you right there. So for the viewers who are tuning in and may not be so certain what you mean by a drug interaction.
All right, so when we talk about a drug interaction, we're looking at the prescription to see if there are two active ingredients that work against each other. So they may work antagonistically, meaning that they directly work against each other, or it might be a situation where one interrupts the breakdown of the other. So in other words, you're going to have this drug in your system for much longer than was intended. You can also have a potentiation of the effects. So let's say you had a blood pressure medication and you're potentiating the effects, you're going to have your blood pressure fall much lower than you would have been comfortable with. So that's what we're doing when we're looking for a drug interaction on the prescription. Since we are talking about a community pharmacy, it might also be a situation where you have seen several doctors. So we would have been looking into your profile as well to make sure that the medication you're getting now does not interact with medication that you are taking long term. So a good example of that would be, let's say that you're on an oral contraceptive, you'd be taking this for months, and now you're taking an antibiotic that would work against your oral contraceptive.
So what I'm hearing is if, for example, you're on a birth control,
correct,
then you may get an antibiotic for an infection that could possibly make your birth control a little less effective, which you never ever want, right? So that's something that a pharmacist would pick up on right away, and then this is saying to me that maybe you need to make a phone call to their doctor.
Right, so at that time, in this example, we would have called the physician. Maybe based on our conversation, we would have made a recommendation to change it to something else that would also be suitable, or we might have to let you know that your contraceptive
so maybe you just need a little extra protection.
Right, basically.
Right. So you mentioned assessing the prescription. So when you hand it in at the window, just taking a quick glance to make sure it's complete and it's correct, and you have the items in stock. You've now moved ahead to make sure that there are no drug interactions, which is absolutely important, and we wouldn't want the pharmacist to rush that at all. What else? Are there any legal complications or legality that you assess?
Definitely. When it comes to a legal prescription, there are several factors that we have to look for and we have to check for. And even though you may not know this, there are several illegal prescriptions in the system, and oftentimes it's the pharmacist that is able to remove them from the system and probably alert the prescriber that someone is trying to use their name invalidly.
Okay. Wow. I think that's quite scary. Right, so we're moving along now. You've assessed the prescription, you've ensured that there are no drug interactions. What about persons who are using, say, insurance?
Okay, so most persons have some form of insurance, whether it's the National Health Fund, Sagicor, Canopy, or Medicus, there are several. For us, we don't actually change anything in the billing. Some amount of technology goes into it where we go ahead and swipe it. Your card normally covers 80%. It might be a situation where maybe at the last minute there's a change in the quantity and we might have to go ahead and do some kind of adjudication or adjustment.
Okay.
There might also be other items that your card doesn't cover directly. You might be encouraged to claim for the item, or it might be something where you need some kind of prior authorization, in which case we may petition on your behalf to have that kind of medication covered for you, or we may go ahead and apply for the pre-authorization for you to make it more affordable. There may be other technical issues where maybe it isn't going through on our side, or it's not showing up on our side, in which case we may have to call your insurance company again on your behalf to try and ensure that you can get the best price available.
That could add to, the wait time as well.
Oh, definitely. It definitely does. One of the other things that you may not consider is you are handing in your prescription. You may have one item on your prescription. Yes, you're seeing it, but there may actually be a couple people ahead of you, and you don't necessarily know what's going on their behalf.
Right. I was about to say that there are a number of things. So the patient could have multiple items on the prescription, but there are people that were ahead of you that you have to give time for. So Jerry, I had another thought. What if I went to the dermatologist per se and I was prescribed something? Quite a bit of compounding would probably be needed to fill that prescription.
Absolutely. When you bring in a dermatology prescription, your dermatologist has assessed you in such a way that she or he is going to basically be asking us to make a drug that is special and specific to you. So it's going to have different concentrations, different active ingredients. It's going to tell us what kind of base to use, and it's going to ask us to compound it in such a way that it's going to work specifically for you and not for another person. So different types of expertise goes into compounding that kind of medication. Not everyone is able to do it, and we are responsible for kind of keeping that kind of chain, or keeping the integrity of such a chain, and so it does take a little while to compound a medication.
Understood. I guess my final thing would be that when I go into a pharmacy, I usually see a confidential corner or a confidential room, and that is where the pharmacist would probably provide extra patient counseling if required, and I believe that could also add to the wait time.
It definitely does. So as I mentioned to you before, we're probably the persons that on your healthcare journey you're going to see us the most, and based on that you may feel more comfortable with a pharmacist. So you may want to ask us, I have a rash on my back, you mind looking at it for me? In which case maybe we're going to look at it and say, well, I think you're probably going to need to see a doctor for this. It might also be that you want to offer a lot of patient support. So it might be that you want to have a word with us, outside of prying ears and prying eyes, and a confidential room really lends itself to that kind of privacy. If we're talking about patient counseling, lots of times persons may call on the phone, and as I said, you do have to be very supportive of your patients, not just from a health perspective, but from a mental health perspective. So
and that's extremely important.
It is. It definitely is.
So there you have it, folks. A lot goes on behind the scenes into ensuring that you get the correct drug, dose, and treatment for your specific condition. Thank you so much for joining us, Jerry. It was a pleasure.
You're welcome. It was nice being here.
Likewise. So until next time, folks, just go on with our meds.